coming all the way from South Africa? That's the real question.
Because I don't think anybody in South Africa can help me and do what you're doing, align my whole body.
What's the issue? What's going on?
I have problems from my neck, spasm in my back, clicking in the groin, clicking in the knees.
But what's the number one reason you came?
The number one reason I came was for you to align my whole body.
Okay.
Okay.
All right. Okay. Sounds good. How is this affecting? Like, what is this affecting? You have back issue, knee issue.
I had what happened last in July, August. I got frozen shoulder syndrome.
Okay.
And it started first with my elbow. I thought I had tennis elbow.
Okay.
Then I got in both my hands, I got numbness.
Okay.
And pins and needles.
Numbness means you couldn't feel it, or it was a buzzing ting.
No, I could feel
okay.
it, and then I got the buzzing ting.
Okay, so that's not numbness.
No,
I just
the numbness, there was numbness first.
Okay.
And then I stand up and I go differently, and the numbness changes. Okay.
Interesting. Okay, so positional changes.
Yes, and then I got tingling in the fingers so
Okay.
badly it didn't go away, and I dropped a glass to my hands. My job is to work with tiny little babies, and I wasn't happy to be holding a baby, and I maybe could drop a baby. So I left the assignment where I'm on. But then I went to see a doctor in London and for the frozen shoulder, and they wanted to operate, and I didn't want them to operate. So I went for.
What needed to?
They want to operate.
To do what?
On my frozen shoulder.
To break up scar tissue.
No. They said I had inflammation, and on the inflammation had worn the
tendon sheath or something?
Yes, it had worn thin, and they wanted to operate, and I didn't want them to operate on my shoulder. So I went for acupressure and acupunch.
Okay.
And then I went back to South Africa because a friend of mine had her leg amputated. And I don't know if I got the frozen shoulder because of all the things that was happening to her. Because when I look it up, it says the frozen shoulder could be from having a mild stroke, or it could be from just stress. So I went back to South
Emotional
Africa.
trauma,
yes.
stress.
Yes. So
there's no stroke.
No.
There's no stroke.
So I went back to South Africa.
Okay.
And I went to see a Thai lady there who did scraping in my back with a piece of wood.
Wasa, yeah. Okay.
And she did my hands and my arms and everything, but I still had this funny feeling in my fingers.
Okay.
And then I went on a month's vacation to Leisner, or George area, and then I went back to see my friend, and I wrote you a letter in November, and then your lady mentioned that you were fully booked, and that
we're in January now.
Yes,
Okay.
and you were fully booked, and that you maybe been able to see me in January, but you have a waiting list. And then I flew into London, went to visit a friend, and she wasn't there. She was here, but I stayed at her place, and then she said I must come here for New Year, and at the same time I can try and see you. And I came to your offices.
There you go. And that's
Yes.
Okay.
Okay.
All right. So frozen shoulder.
Yes.
Low back.
Yes.
Knees.
Yes.
And
I got a clicking in the groin.
in the groin.
Yes.
Right
groin.
side.
On the right side.
Not the left.
Not on the left.
Okay. Can I have
Okay.
you stand up and let's watch you walk, please?
Okay.
Okay. Let me turn around. I can cover you up here. All right. And why don't we come over? Start over here, please. And let's watch you walk back and forth several times. Good. Good. You're gonna stop there, turn around, and just keep walking. There you go. Regular walking. So you can see the left. Keep walking. You're just gonna keep walking. So you can see when she's walking, she's a little guarded, a little stiff up top. So as she's walking here, you see it's kind of up on the left side, and then she kind of tilts to that right side. Kind of tilts that way. So the question is, where is this all coming from?
Did you hear the click? Sometimes I'm not sure if the click is in the groin or if it's from my knee.
Well, it's all connected, isn't it?
Yes.
We just got to put everything back in balance now. So there's a lot of stiffness, there's a lot of guarding. When she's walking, again, her body is her pelvis is favoring left, her upper back is favoring right. That's what we need to figure out. You can see it clear here. When she walks here, hip wants to go that way, upper body wants to go that way. Okay, let's have a seat and let's check you out. All right, so the first thing we're getting is a big 27-point reading at about 20 point, 25, 24. Let's do that again. There it is. And that's way up top.
That's the
C1,
stiffness
C2.
in the neck.
Yes, ma'am. So we got a pretty significant reading here, C1, C2 on the left. Let's continue. We also have it here around T2, T3.
That's a spasm,
There we go. So South Africa, huh?
yeah.
And you're working with kids.
Yes.
I saw an email from you, was it a week and a half ago, where you took a picture of yourself in front of my door.
Yes.
And we were actually closed the office.
Yeah. I thought if I took the photo outside your door, then you'd see I'm actually here in America.
I'm impressed. You figured out how to get all the way over to America. I got 12 points in the 10 points in the low back. So I'm getting pressure in the tailbone, S1, S2. I'm getting it around T2, T3, and I'm getting C1. Those are the three majors in the spine that I'm seeing first, okay?
Okay.
Next thing we want to do is let's start by evaluating your pelvis.
Okay.
Scoot forward, please.
Okay.
Okay, and let's watch here. Open and close your feet touching. Open and close your knees. Open and close. Good. Open and close. Good. Right side only. So when she does the right, nothing's happening in the left. It's moving fine. Left side only. Okay. Keep going. So when she does the left, the right wants to shift with it. Do you feel that?
Yes, I can feel it. It's really difficult to
Tender
do.
right there.
Oh, wow.
Yes?
Yes, yes, yes.
Scoot back for me. So we have a right pelvis. It's stuck on the right side. This is the top of the joint, middle of the joint, bottom of the
That gives
joint.
me an instant headache.
Bottom or the top?
They're both.
All of it. Let's do that again. Top,
Oh,
middle,
there.
and bottom. Top,
Yes.
middle,
Oh, there.
bottom.
Oh, it's sore on all three, actually.
All three.
Yeah.
So the whole side of the joint, yeah?
Okay, yeah.
Okay, let's go back to your static palpation of the spine. Do you need your glasses?
No.
Put yours there. You can take mine off here. Now, let's come over here and check out the spine. Let's do some static palpation. And let's see. So right as we start to statically palpate, we can see a lot of the swelling edema. Orange peel right there. 1, 2. That's 3. You feel that?
Yes.
That's 2. That's not as bad.
It's bad.
That's
no,
3.
There, yes.
4, 5, 6, 7, 8, 9, 10. This is all good. So T3, 2, 1, 7. I'll mess up your hair a little bit, okay?
You can mess it
There you go. Right there.
Oh.
Okay. Now let's test out and look down all the way. We're going to test the upper cervical motion. Turn left, turn right.
Oh.
Okay. So a little restricted on that
Yes.
right side. Look up, up. Now looking up, turn left, turn right. Not so bad there, right? Not as bad as when you were looking down.
Yeah. Yeah.
Right
I got it.
there.
Okay.
So we have ASL
Oh.
ASL,
Okay.
A atlas.
Okay.
All right, we have T3, 1, 2, 3.
Yes.
And now let's go ahead and check out this. We have a right pelvis, and we have to check the tailbone and the sacrum. That's L5, okay?
Okay.
L5.
Okay.
So just even bringing her back into extension, look, she tilts to the right side. She doesn't come back straight. She goes to the right. Come back straight. She can't. She goes right.
Yeah, okay.
You see that?
Yes.
Okay,
yes,
well, that's the first thing that needs to change, lady.
Okay.
Okay?
Okay.
L5, S1,
Okay.
S2. Not S2.
Yeah.
S1 or L5?
Both those two.
S1, 2, how about 3? Nope, S1. Now, if we have two joints that are bad, we're not going to adjust a bad joint over another bad joint, are we?
Yes.
No, we're not.
No.
So we're gonna figure out between S1 and the right pelvis. We're gonna do T3 and the atlas. Then we talked about the right pelvis and the sacrum. What do we see here? We see rotated right sacrum, 69 and 63. So we have a rotated sacrum on that right side.
Yes.
With that, we have what's called an ASI and ilium. It's gone up. Yep.
Yeah.
Sorry, ASEX. It's gone up and slightly out. But the AS, the up component, is more significant. Now, according to the work, if I actually fix this right pelvis, I'll be bringing it down. It's going to make this leg length inequality more. We don't want that.
We don't want that.
If this one is misaligned, so basically the right pelvis is misaligned up, but because of the leg length inequality down, it looks like it's tilted down. And that's what's starting to create this curvature in your low back, in your lumbar spine. Now, if I go after the left pelvis, which we're not because there's no fixation, but let's say we were.
Yes.
If we were going after the left side, this number says that it's gone down. We bring it up, it's going to make the right
Even more.
more.
Yeah.
So the answer is not in the pelvis right now. The answer, we said, is in the sacrum.
Sacrum.
So we got swelling, tenderness, S1. This is where we're at. We're going to be starting here on S1. Let's change the contrast a little bit. A lot of old injuries, a lot of scar tissue in there. We need to get the alignment sorted out, get you moving again. As you're moving again, then we can work out the scar tissue for you. Okay? We only have a week here.
Okay.
All right? So
Okay.
we got to go after it with your permission.
Yeah.
Okay. That's it. Now, let's continue. Let's look at the whole picture. So, the whole picture is this. When we look at the whole picture, and we can see, what do we see here? You don't really have, you have actually a straight spine. It looks curved. It's not curved. It's bending back.
Okay.
We want it to curve back. And we talked about there's what's called a stair-stepping effect here in your lumbar spine. And that stair-stepping effect, as an example, 3 is posterior to 4, 2 is posterior to 3, 1 is posterior to 2, and so on. And all of that is creating this stair-stepping instability in the back. That's all starting down in the tailbone. Okay, that's where we need to start. Now, let's go ahead and look up top at your neck. Overall, neck's pretty decent. Your discs are good there. We have a few things going on. We talked about up top in C1. But in terms of your discs are great. You had some old injury in here, some scar tissue, but overall looks good. I did say there's something going on here.
I had a collarbone that I broke at one time.
Yes, you actually dislocated it.
They said it was a broken collarbone and it was
On the right?
on the right.
Okay, and then what happened on the left?
I don't know, that could be from...
Because the left looks a little bit off too.
Okay.
But okay, so you broke the right collarbone.
Yeah.
Okay. Now here's what I want you to see with the shoulder. So this was a left frozen shoulder.
Yes.
Now, when we look at this, this is what's interesting in this case, okay? Look at this curve.
Yeah.
This is your upper back. So there's a lot of instability in this upper back. So this is contributing to the shoulder. So look, it curves like this to the right, then it curves up to the left, making your shoulder appear higher on the left side.
Yeah.
But
Okay.
it's not that, it's coming from your spine.
Okay. Could the weight of my breasts affect that?
There, it can contribute to it, sure.
Okay.
So if, well, first things first.
Okay.
Let's get things in alignment. Let's get you moving.
Okay.
And after a couple of adjustments, we can see how your mobility is. We can make more decisions down the road.
Okay.
Fair enough?
Okay.
Okay, are you ready?
Yes. I'm
Let's
ready.
do it.
Mhm.
All right. Left hand here. And just breathe in through your nose. I know that was another issue we talked about.
Yes.
We need to get you breathing through your nose.
Oh.
Okay, we have a lot of tension here. Home run, baby.
Oh, my word.
Gotcha. Back down, please. And that's what we call a home run, baby.
Oh, wow.
Give that a second, okay? And just breathe. Let us know you're okay.
I'm okay.
All right, just want to make sure. Then let's go ahead and do your sacrum. And then I'm going to have you walk. And then we'll come back and check 3, okay?
Okay.
Almost. Relax the shoulders.
Oh, oh,
That's
oh,
a home run, my dear. I got you.
Okay.
You're okay?
Yes, I'm okay.
I got you good, lady.
Yeah, okay.
Walk it off, please. And just from that, look straight ahead, please. Keep walking. What's different?
I'm sort of wobbly now to that side, am I not?
Your body's trying to figure it out.
Yeah.
Turn around, please. Okay, keep walking. Swing your arms when you walk, please. So her glutes, for lack of a better, her butt goes up and down now. It's not waddling
It
this
was
way.
waddling like a duck,
Now
and
it's
going
going
up and down.
Now you're
Okay,
getting your up and
okay,
down motion.
okay.
So watch here. It's moving up and down now. Walk. See?
Okay.
We got you got the shake back.
Yeah, okay.
Regular walking back and forth. As she's walking, you're gonna have it's gonna be an interesting next 24 hours. You had a lot of pressure in your body, and things are already shifting as you're walking right now. More you walk, the better, okay?
Is it okay?
Yes,
so
ma'am.
I can go for a long walk.
Yes, ma'am, please do. Let's go face down on the orange table, and let's work on your thoracic now for your shoulder, okay?
Okay.
Face down. And then we'll check your shoulder out. Slide up. Head is okay, chest is okay, throat is okay.
Yes.
Good. Slide down a little bit, please. There you
I'm catching my breath.
go. Okay, fix yourself then. T3. Rest is okay?
Yep. Ah! No.
Nope. I got you. Let's do that in the chair. Is that blocking at your breast?
That's the breathing, I think.
Got it, okay.
That's the breathing because of my breath. Yeah, that's the breathing, I think.
You're not gonna make my job easy, are you?
No.
You gonna make me work for this. There you go.
Okay.
Alright, jokes aside now. There you go. T3. Now, I'm going to be lifting up, okay?
Okay.
Just let me do the work. Hands on your lap. Try not to brace.
Oh my
And
word.
that's a home run, lady. T3
Oh
in the
my
chair.
word. Did you hear that?
Yeah, I heard it. Take a deep breath. Check it out.
Wow.
In through your nose.
Is my nose and my jaw skew
I
as well?
will be working on your nose and jaw in a minute.
Yeah, I can see.
Taking a deep breath, please. Stand up and walk and breathe. Tell me if anything is different yet. Even through your mouth.
Oh, I've got to breathe through my mouth. I haven't been breathing through my mouth. Yeah, I don't breathe through my mouth. I breathe through. Oh, I breathe through my mouth and out of my mouth. So I'm not
Now I
breathing
want you to breathe through your nose. There you go.
But it's like it's.
Come back
Yes.
over here, please.
That's my problem. I don't breathe through my nose.
On your back.
On my back.
On your back. You're getting your nose job now. Can't get away for the nose job, right? Hands on your left, please. So what we can see with her nose, chin down, it goes like this. The high side is on this side, on the left. So we're going to take it like this. We're going to set it through, just like that. Okay. Let's do one more. There. There you go. Breathe in. Good. All right, lady, walk it off.
Sure.
Okay. As you're walking, tell us if there's anything different.
Is that
Let
the.
me touch you, please.
Okay. Do I have to practice? I'm going to have to learn how to breathe through my nose.
I'm going to teach you. That's the easy part.
Okay.
Don't worry about that. I'm going to show you a very simple breathing technique, okay? We're going to start that today.
The nose wasn't as. I thought it would go worse, like when my son broke his nose at hockey.
Do you see how your walk is different, ma'am?
Yes.
Do you see how you move your shoulder, move your left hand, move your shoulder up, raise your hand, raise your right hand, raise your left hand.
Oh my word. Okay, there's still a little bit in there, but it's a big difference.
But I haven't touched your shoulder yet.
Oh my word.
That's what I'm trying to show you.
Yeah.
Let's work on the shoulder now. Let's continue.
Okay.
Let's clean up the rest. Have a seat. Now the bonus.
Oh my word.
That's the ears. Relax.
Okay.
There you go. Let me do the work. Let me do the work. Bend the elbow. Down. Down. There you go. Stand up for me, please. Squeeze my hand. Squeeze. Squeeze.
Oh, goodness me.
Hold on 1 second. I need some light. It's too beautiful. Squeeze. Squeeze hard. Can I show you a very simple breathing technique you can start today? Yes? Go ahead and have a seat. It's one of the breathing exercises in yoga. So, thumb on the right side, index finger on the left. Okay, we're going to start by holding the right side.
Yeah.
Breathe in.
And out.
And out the other, sorry. Let's start again. So basically we're going to do this. Breathe in, breathe out. Breathe in, same side. Nope, same side. Breathe out, opposite side. No force it. Take your time. Take your time. In, out. In,
And then in there.
out. You're going to practice this 5 to 10 minutes every day minimum in the morning. If you want to do it at night too, please do. Okay? All right. Now, go ahead and walk one last time for me. And tell me what's different. I want to hear it from you now.
My bottom feels bigger because it's going like I'm walking. Yeah, I'm walking like that.
You're walking straight now. Straighter.
Yeah, I'm not going like that.
Correct. You're not doing the waddle now.
Okay.
You're from Cape Town?
No,
Where?
from the Free State.
Where's that?
The Blvd area.
Okay. Okay. So now your glutes are moving, your hips are moving. Is that clicking there right now?
It's not clicking here anymore, but I feel the click
On the knee?
on the knee.
Okay. Let's
Do you
do
hear
one.
it?
The hip, not in the hip though.
No, it's not feeling like in the hip there. Now it's sounding as if it's on the knee.
Okay, go on your back here, please. Let's do one last thing. Lift your head. And let's do the knee, okay? Sound is going to be the board. AIN femur right there. And in the back. But we're going to do the AIN there. There you go. There you go. Okay, stand up and let's walk that off, please. You don't need my help. You're all good. Walk it up. There you go.
My bottom feels big now.
Well, the bottom is going to be sticking out more now, okay?
Yeah, because it's
Because that's how it's supposed to be. You better be okay with that.
Yes, I know, but I'm okay with that. Of course I'm okay with that.
Okay. All right, why don't you go ahead and get changed?
Okay.
And then when you come back in the room, I want to do one more test with you and change it. Okay?
Okay.
Okay?
Yeah.
All right. Now get up. I want you to get up and tell me, should be easier to get up.
Yeah. Yeah, it was easier to get up.
Yeah?
Yeah, it was easier to
Okay.
get up. Yes.
Hands up. Okay. Face the wall this way. Bring your left hand behind your back, all the way up your spine. Thumb up your spine, right there. Bring this back around. 1, 2, 3, 4, 5, 6, 7 and a half. Bring your right hand behind your back. Looks even to me, man. 6, 7 and a half. Shoulders are even.
And my shoulders even now.
They are more even. You're going back evenly. Okay?
Okay.
That's where we're going to start with you.
Okay.
Welcome to the office.
Okay.